Today is World Obesity Day, and a coalition of organisations from around the world are coming together to launch World Obesity Day. What are they hoping to achieve, though? Let's talk to Johanna Ralston, who's Chief Executive of the World Obesity Federation. Good morning to you.
Good morning, Julia.
Good morning. So what is the point of World Obesity Day? Because often we're celebrating something with a day. We're certainly not celebrating obesity, are we?
We're not celebrating obesity, but we're celebrating that we're coming together to recognize that it's really a shared responsibility and a challenge that touches us all. And so that's the reasoning behind World Obesity Day, is to really draw attention to the challenge, find solutions together, recognize it doesn't sit in any single sector, and that we all have a role to play.
OK. I think there'll be a lot of people listening to this saying, if they're not overweight themselves, well, actually, they don't have a shared responsibility. They don't have a role to play. And we do know what the solution is. It's eating less.
We would love for the solution to be that simple.
It is that simple.
It's eating healthier. It's certainly ingesting fewer calories. It's eating healthier calories. It's having opportunities to be protected against unhealthy foods and beverages.
Protected?
It's also understanding protected in terms of...
Well, are these people, I don't know, these people walking down the streets and someone is thrusting a McDonald's milkshake in their hands and forcing it down their throats? What's happening to people? I didn't realise this was such a problem.
I think the 650 million adults around the world who have obesity often don't have options. It's definitely skewed towards lower income populations where there are fewer food choices, where they live in food deserts. That's part of it. The 125 million children, 5 and under, who have obesity certainly did not bring it on themselves, and I think are exposed to what are called obesogenic environments, which are inherently unhealthy, limited opportunities for healthy whole foods and physical activity. So it's that sense of our wider environments have become obesogenic. That means that they help create the conditions of obesity.
I mean, I would say obesogenic conditions for a child is simply having a parent who doesn't do their job as a parent. I think that, is there not an issue? And there's something in the papers today about how we shouldn't be calling people who are fat, after a bunch of complaints from fat patients to medical professionals saying they're being stigmatised, and how being fattest to a certain extent is akin to being racist. But of course it's not. I can't help the colour of my skin. No one can help the colour of their skin or their gender or their sexuality, but you can help the weight you are. Most people listening to this right now who, I've done, health kicks over the years to lose a couple of stone or here and there, and try to maintain a relatively healthy balance in terms of my diet, my exercise and my weight. And lots of people do that. They may be saying, well, hold on a minute. We know what we need to do to stay healthy. We know what sort of weight a child should weigh, what we should weigh. People who don't do that are making choices. When you talk about, people not having options, everyone has the option not to put more unhealthy food in their mouth. Are we not taking away a level of personal responsibility from people, from the ownership of what they put on the fork that goes into their gob?
So certainly personal responsibility plays a role when the options are healthy, but many people don't have healthy options.
What do you mean people don't have healthy options? Are you saying that they live in areas where no supermarket sells apples and broccoli and they only have takeaways? Because I've been to a lot of places around the world and around Britain, and some of the very poorest parts of inner cities in this country, and there are still vegetables and fruit in the supermarket aisles.
In some cases, you're correct. And in some cases, it's not true. We're seeing, I'm going to just call this a global issue. We see, for example, in low-income countries, places where there is absolutely no healthy food available. And we see that even in places around London and Southwark and Lambeth. You have some examples of this.
No, I'm sorry. I worked in Southwark for 2 years. There's plenty of healthy food available in Southwark.
Okay.
No, but I know this is the thing that people listening to this. I realise that most people doing an interview with you today will be going, "Oh, isn't it awful? Isn't it awful? What do we do about all these horrible fast food giants?" Look, the reality is we all have a choice every day about what we put into our mouths. When people are very, very obese, we know that often we are talking about mental health issues that are contributing towards their need, sort of to need food in an emotional way rather than a physical way. There is nobody in this country at all who cannot buy healthy food and who cannot stop putting unhealthy food into their mouths.
Okay, so 70% of obesity has a strong genetic component. That means that if your mother had obesity when she was pregnant with you, you are going to be born predisposed to obesity.
Yes.
So you're already having the cards stacked against you, 70%. So that's not an insignificant number. It's not just about what you put in your mouth.
Fat people have fat kids and give their kids more food that makes them fatter. Yes.
People with obesity, and we call it with obesity because we know it's a disease. And
it's
like
not a disease. Johanna, how can it be a disease if somebody can cure themselves of it without even seeing a doctor?
But that's not true. Most people can't. We've seen in the studies with weight regain, most people have weight regain because their bodies have fundamentally changed, and that has a strong genetic driver.
There's no doubt at all, isn't there? That I completely accept that there are some people who can, they can eat a full fry-up every day and they won't put so much as a gram of weight on. I accept that, and there are people who just have to look at an apple and they put weight on. There's no doubt all that. But for the vast amount of time of human history, we have not had obese people because people, and if you go back to the 1970s, we didn't have huge numbers of obese people and overweight people because people didn't eat huge amounts of food. The issue is people eating too much food.
Julia, we've been doing a huge experiment on people over the past 30 or 40 years where we've had much, much, much greater presence of cheap, ultra-processed foods.
Yeah, except that, yeah.
Red meat, much a bigger component of diets everywhere in the world than it used to be. All of these drivers of obesity. So we've been doing, as you said, until 40 years ago, we didn't really have this problem on a large scale. People had a genetic predisposition to obesity, and we didn't see it except in sort of different ends of the spectrum. As you said, a few people eat anything they want and they don't gain weight, and on the other end, people who can hardly eat anything and gain weight.
Okay.
What we've done is we've driven the curve over toward, because of this giant, essentially, experiment, we don't even know why it is that ultra-processed foods have played such a huge role in this, but they do, and we know that they do because we see it before us.
Yeah.
And so we can't just solve it by taking away a single thing. We need to change the whole environment, the environments people are in. The reasons they regain weight after even bariatric surgery has to do with going back into that same environment that they were in.
They go back to eating the same amount of food, surely. Johanna Ralston, I know you have to go, but it's been an absolute pleasure debating with you, Chief Executive Officer of World Obesity Federation.